Reddit, what's an unknown fact that could save your life? The best defense against an aggressive bear is to get some sort of large object, like a large tree, or car, and just keep moving around it, keeping it between you and the bear until they get bored and leave. Bears are way faster than people in straightaways but cannot maneuver around the object as quickly due to how big they are. Do not try and climb the tree, just keep it between you and them. This is known as the squirrel defense. Now if there are two bears. I thought you meant grab an actual tree or car. I mean, if you can, you should probably go ahead and do that. Never give an unconscious diabetic insulin. Please. It's quite likely to kill them. I was told, if in doubt, give them sugar. A low blood sugar person, hypoglycemia, needs the sugar, so problem solved. High blood sugar person, hyperglycemia, doesn't want sugar, however going higher won't create any more problems than they are already in. If they're unconscious, you wouldn't want to give them anything by mouth. They aren't able to protect their airway and it could lead to bigger problems. I'm a paramedic and we have this amazing medicine called D10, which is essentially sugar water in 4 form, and it amazes me every single time I see it. Basically you give it and within a few minutes, that patient who is unresponsive is now talking to you and wondering what in the hell you're doing there. Drug users or alcoholics often use in the same places / with the same people / around the same time of day, so your body is conditioned to that, and when you are in these familiar situations your body is basically preparing for you to use drugs. When you switch up your normal routine your tolerance is actually lower because your body wasn't triggered by your surroundings. This is important to consider to prevent people from overdosing by using a similar amount as normal in a situation where their tolerance wouldn't be the same. Situational specificity of tolerance effect. Set and setting play a huge role in druggery. Your mindset and surroundings. I could smoke a joint in my living room and barely notice it, or I could smoke a pinch hit in public and end up hiding in a bathroom stall checking my credit score. If you smell a fish smell in your house, some people also report a urine-like smell, for no reason. 9 times out of 10 it means there's an electrical fire. If someone is stabbed or punctured by a sharp object, leave it inside. Do not, absolutely do not, try to pull it out. Leave the object in until help arrives. Pulling it out will only double the damage. The object can considerably reduce and stop the flow of blood by exerting pressure on the injured area. The moment you pull it out, blood flow is likely to increase. Probably said already, but bad CPR is better than no, even if you're unskilled. You literally cannot make the person more dead, as being dead is what predicates CPR. If you have a puncture wound to the chest or abdomen, the first thing you should do is place a non-porous thin plastic bag, object over the wound. It will help prevent tension pneumothorax. A tourniquet is quite simple to put on and can save a life if there is no other option. Place close to the site or near not on a joint. Never remove a tourniquet once placed, as clots can travel to the brain and lungs. Also mark the time you put it on. If you're at an accident scene and have no medical training, something you can do is collect information and help calm victims. This is quite helpful as it assists the paramedics with triage and keeps potential injured persons' heart rates down. Alternatively, learn how to hold C-spine. If your car ever gets stuck on the train tracks, look for a sign on the crossing arms. This is the Railway 911 and has a number to call to stop traffic as well as your exact location. If you've been cut deeply, pack gauze into the wound as tightly as possible, then hold pressure. Related to your second point, about a puncture wound to the chest or abdomen, a driver's license or other ID is something that most people will have on hand that could work. In boot camp they taught us about sucking chest wounds, which according to my googling is the same thing as pneumothorax. Called sucking chest wounds because that's literally what it is. A wound to the chest that has suction. Commonly caused by gunshots, stabbings, or other kinds of puncture wounds. The tool they taught us we could use if we had to was our military ID cards, or a driver's license. Said to just put it on there and the suction of the wound would hold it in place long enough to provide other assistance and or until better qualified people could get there to help. I've never had to do anything with that, so take my words with a grain of salt, but I definitely won't forget sucking chest wound equals ID card. If someone's trying to kidnap you, your chance of survival drops by 50% once you get in a vehicle and even more once you reach a destination. I saw a guy on TV once say this when I was a kid. I don't remember the guy. I don't remember the show. But I remember that he was on a panel and he stood up, took several steps forward, pointed at the audience and said, "Never ever go to the second location. Never, ever, go to the second location. Do whatever you have to do to stay where you are." We get cranky about red eye reflex in photos, but seeing that red reflection in a flash photo is good. That's light bouncing off the nice red back of your eye and back out the pupil. If you see the pupil reflecting white in a picture of a human, especially in children, get them to an eye doctor fast. If no reflection, no worries, that's also normal. White reflection, in a human eye, means that either the retina has turned white, say, from loss of blood, or that there is something else in the eye in front of the retina that is reflecting instead. Either is very bad, but if there is something else in the eye reflecting white, it's unfortunately good odds that it's cancer in the eye. Eye cancer is very bad since the eye connects to the brain by the optic nerve. If cancer isn't caught quickly, it can go up the optic nerve to the brain, and cancer metastasized to the brain has poor chance of survival. If giving aspirin to someone having a heart attack, make sure they chew it. It works far faster that way. If you can't or don't want to use a rehab, ask your doctor to help you. They are more than happy to assist you tapering off and dry up safely. So many people don't know how dangerous alcohol is. My dad nearly died twice because he tried quitting by himself. If you're ever underwater and can't tell which way is up, knocked around by a wave, just blow a few bubbles out as they always go up. Similar concept if you're in an avalanche and you're completely covered with snow. Spit, and start climbing in the opposite direction it falls. Rescuing a drowning person can be just as dangerous as drowning. That drowning person is completely panicked and has only one goal: get air down their pipe, and the desperate drownee will do anything to obtain it. That includes climbing on top of a perfectly able swimmer and submerging them underwater to get their own head above water. Know your limits. If you yourself are a poor swimmer or the water conditions aren't favorable, strong currents, rough waves, murky water, don't attempt rescue. Immediately contact emergency services and throw something that floats at the drowning person. If you do feel confident to perform rescue and the water conditions are favorable to your abilities, make sure you take something that floats with you so you can immediately hand it to the drowning person before they latch onto you. If they attempt to make a grab at you, immediately kick away. Feet should be pointing towards to the victim, and thrust the flotation aid at them. If they still attempt to grab at you, keep kicking away until they calm down or even pass out. Better only one person to rescue than two. I'm seeing quite a few comments saying don't be afraid to punch them in the nose, or I got told to try to whack them to knock them out. To those I say, no. No no no. Please do not try to punch, kick or attempt to knock out a drowning person. You're trying to rescue someone in the water, someone who is flailing around and panicked. How are you able to get a good punch in, especially in the water? Great, not only are you trying to rescue a drowning person, you now need to rescue an unconscious person. Good luck getting back from that. Just why? And probably the biggest one of all, you are trying to get away from a drowning person. You don't want them near you in case they grab you and pull you under. If you are close enough to hit them, you are close enough for them to get you. Trying to punch a drowning person is completely outdated and not only further endangers the person you are trying to rescue, but puts you at risk as well. As current and trained lifeguards have already commented, if a drowning person grabs you, swim down further underwater until they release you. Remember, the only goal of a drowning person is to be able to breathe and stop water getting in their lungs. If you are pulling them underwater with you, that goal can't be achieved and they'll let go of you. Thanks for watching Team Astro. Subscribe for more videos. Daily fun facts before you leave. You cannot snore and dream at the same time.